Welcome to Forethoughts of Our Founders. I am Herman Felton, the podcast for the Higher Education Leadership Foundation. Boy, did we have a good one for you today. Super excited to have our guests who are closing out the first part of our series entitled Navigating Through Higher Ed's Next Defining Moment. And no one really needs to search far or wide to determine what that defining moment is. It is all things COVID and what is new to us. But there's a space that we have not explored as much as I think we should. And I think my guests today agree with me completely. We've got some professionals from both the HBCU space and the PWI space, and we're really excited to have them connected to all of these scholars and practitioners. Joining us today is Dr. Micah Griffin. He is the Director of Health Programs at CUNY Kingsborough, right? Community College in
Yes,
Brooklyn,
sir.
New York.
Yes, sir.
Welcome, Micah.
Thank you. Thank you for having me.
Thank you for being here, Dr. Ray Lundy, who is the Associate Vice President for Student Health and Wellness and Career Counseling and Coaching and all that other stuff at Wiley College. Thank you for being here today, Dr. Lundy.
Thank you for having me.
And rounding out our panelists is a scholar and practitioner who's up at Virginia Union University. Dr. Shanita Brown is the Director of Counseling Services with my good friend and colleague, Dr. Hakeem Lucas. Welcome today, Dr. Brown.
Thank you for having me. Excited to be here.
We're excited to have you all to talk about healing and hope, addressing mental and healthcare disparities of students of colors. I want to go back. This is a question that I've had, the good fortune to glean a little humor from all of our guests this week. And to pose a question that is simple but has yielded a variety of different responses. Where were you when COVID hit and you knew that it was real?
It seemed like years ago now, right? I think now I'll start that off. I remember actually now thinking about that. I was actually at a conference in Seattle, Washington.
Okay.
And I don't know if you all remember, but Seattle, Washington was one of the first areas that really had, positive cases. And I was there for a conference, and it was one of those conferences where everybody's sitting in the room together. You're having those close face-to-face conversations, you're networking. And it was like 3 or 4 days after the conference had started when all of these cases started showing up. And then I had to fly back to New York like 2 days after that. And then New York was like almost the second hardest hit area. And then when I got back to campus, there was, talk of, are we staying open? Are we closing? So this was very early on in that phase. And it come to find out about 10 people that were at that conference actually tested positive. There was almost a cluster that came from that conference. So I was blessed to, get out of there just in time. But I do remember that flying from one highly infected area to another, like right after that. So that was interesting.
Yeah. Dr. Brown?
I would say for me, it really hit me in March. I was the day before my birthday. I was planning a trip. I thought I was going to Miami Jazz in the Gardens for a mini vacation, and the NBA and things started to cancel left and right, and it kind of hit me then. This is really getting ready to change our country, and so it really hit me that things are beginning to shift for me, my family, and the world, and so that really kind of really got my attention then when you started seeing national sports organizations and things of that nature begin to cancel events. And then the Jazz Festival canceled the next day.
Oh, pooey.
No. For me, I think because we're trying to be, we do the opposite. When crisis happens, as clinicians, we're calm. Everybody else, or as those in the helping profession. So I think things it takes a while for things to hit me. So I think our students were gone. You know, campus was empty, so to speak. And unfortunately, it didn't hit me until the unfortunate loss of one of my colleagues here at Wiley College. And that person happened to be my next door neighbor as well. So I think that for me, I do as I often do, which is go into crisis mode and to help and to fix. But I think in that moment, there was a sense of loss of control and not being able to fix this. That made it real for me. And yeah, and it also helped me early on to be really clear about what our students might have been feeling. So yeah, I think that was in March.
COVID aside, mental health, why, and this is a point of, I guess, personal reflection, but why are we having challenges in the Black space of dealing with mental health being a part of our personal health and wellness? Why are we grappling with that, or why have we grappled with that? Can any of you, hypothesize on why that is such a struggle based on what you've heard from patients and maybe their reluctance to come and speak with you?
I would just say the stigma attached to mental health.
Mm.
And seeking services. And so these are topics we don't talk about a lot in the African American community. And we sometimes tend to think that, oh, I'm okay, and not necessarily put in a name that we grew up here, my nerves are bad. And we having to educate our students. Like they've been really dealing with a lot of this already prior to coming to college.
Mm-hmm.
And so COVID just really exacerbated a lot of things. And now they're beginning to put a name to what they're experiencing. So a lot of this is just a lot of stigma and taboo subjects in the Black community.
Yeah, I think that help seeking has been something that Black folks have been negatively reinforced for. So when we say we're struggling, if you think even back to slavery, if you weren't able to hold your weight, or if you showed some sign of weakness, that could mean death in some instances. So there's a long history of Black folks being mistrusting of the healthcare system in general, just broadly speaking. And again, sometimes when we've shown vulnerability, it has not fared well for us. And I think mental health, seeking support, and help seeking behaviors, all of those things require a level of vulnerability in a sense to say, I'm not okay. And I think giving ourselves permission to do that has been hard when we are given other messages culturally.
Yeah.
Yeah, I agree. I'll just quickly add to what Dr. Lundy said. I think it is tied right into that belief, that resiliency, how
Mm-hmm.
and saying, I got it, I can handle it, I don't need nobody. And, through generations, if we go all the way back to what Dr. Lundy was mentioning, that's just been entrenched in us, I think, as people. And I don't think we're seeing any difference with that, especially with our students. And on top of that, they don't even have enough time to process, because you're going from one thing to the other so quickly, and you're not able to find those answers. Like, they're the generation where they pick up a phone and anything they want, all the information we've ever had to mankind is on that device.
Yeah.
But right now, they're not able to go out and search and find that information because it changes so quickly. So it's almost like, who are they going to? Who is that source of information? How are you getting by? How are you making your, informed decisions, when before you were able to do that and you were able to get some type of response immediately, but that's not happening.
So how we're, on this quest to reimagine a human that is well-rounded, and we're getting these people, us in the Black community, to reimagine how we think about masculinity, how we think about acceptance. We need to also be re-engineering what it is to seek mental health. And so I was just always curious to talk to professionals about why they think we are there. I know the stigma, even as a young man in the urban community growing up in poverty, I knew what and how we used words that are now looking back on it unkind, but it was a part of how we dealt with people not feeling well and the stigma, as you said, Dr. Brown. Let me ask you this, and I'll start with you, Dr. Brown. What's been the greatest challenge in managing and supporting mental and health on your institution for faculty and staff and students during this time?
I would say start with students first. Missing the face-to-face sessions. Counseling is just this heavy interpersonal relationship building, and so for my students, not being able to see them. And as Dr. Ray said, we're always thinking of others. So I'm beginning to think, how are they doing? I can't see them, specifically for the ones who are already in counseling prior to COVID, and then having to try to figure out, be really innovative and strategic on how to check in with them on their well-being. And that has been some of the challenges. And then also, I would say some of the licensure and the legal and ethical situations that come up now in regards to distant counseling, and if your students aren't in the state where you're licensed. So it brought up a whole new type of thing in
So that's
regards
a whole issue in and of itself. Does that
yeah.
mean that students are precluded from receiving the services because you are crossing state lines?
Yes. Oh my God. So many things happen. Like in March, like Dr. Ray said, we went into crisis mode. We're thinking about our clients, and how can I connect with them? And if they leave the state, if they leave Virginia and I'm not licensed in Maryland, then I can't provide them services. And so all of our national counseling boards begin to work together collectively. How can we provide some leeway to our helping professionals in the form of psychologists, licensed counselors, licensed clinical social workers, anyone who has any type of state license. They begin working together across the board, allowing our state boards to say, hey, you can see someone, but you will have to apply for licensure in that state. So it was so much going on in regards to clinical care for our students in the beginning.
Anybody want to add to that, the challenges that you faced?
I would say that everything Dr. Brown said, and on top of that, because of my role here at Wiley, also being kind of managing, being the health administrator for the physical health side, I think what has been most challenging is kind of balancing, needing to make sure that students and staff are okay emotionally, but then also more than I think I've ever been aware of is just the connection between the physical and the mental health. Also being just honestly concerned about people's level of anxiety around getting sick. So, for the staff who are still on campus, even though we were engaged in, we're in remote learning, our staff were not on campus, but as an administrator, still having to think of what would that look like? And then in moments feeling like, I don't know how this puzzle is gonna fit together, because in terms of keeping people safe, the information was constantly changing. Is it 6 feet? Do we wear masks? Do we not wear masks? How many times do you wash your hands? And like the level of emotional distress that in and of itself could cause. Mm-hmm. So I think for me, it was the balancing act. It was the act of saying, you know what, it's okay for all my clients. And Dr. Brown started with students, but although we technically don't see staff, staff became my clients too, trying to help them balance the anxiety that they had. And maybe it was often in an informal sense that they became clients. Like we didn't necessarily, but it was like, how can I see people in distress and not help them? So it was balancing the students' needs being introduced more to the health administration part. And actually, that was how I met Dr. Griffin, who is a part of the Association for College Health Centers, ACH, the American College Health Association. Yes, I got it right. But I met colleagues who were also having the same struggle. So for me, it was like, okay, I'm a clinician. I can do this with my eyes closed. Yeah, I can tap dance over here and do the clinical mental health piece. But as I'm also trying to be a health administrator and managing this new virus that no one knows anything about, that everybody is anxious about, like, how do I do that for the staff and students and faculty that I'm serving, and then maintain my own mental health? So it was a balancing act.
Cool.
Yeah. I would just echo what both of them, both Dr. Brown and Dr. Lundy said. I think the biggest probably issue for us was the transitioning from in-person to virtual. Like, what does that look like? Like, how do you take, a face-to-face interaction that the student has on a weekly basis with their clinician, and then translate that to getting the same type of interaction virtually? So we had a lot of issues with transmitting that and seeing how we can create more innovative ways to engage students. Because as we know, once they physically leave campus,
it's whatever.
And that was huge for us, especially here, in New York, where we have students from everywhere. And we have students, by our campus being in Brooklyn, we had students commuting from, Manhattan, Queens, the Bronx, and they were using public transportation. And before our campus closed, the train, if you've ever been on a train in New York, ain't no 6 feet. Like, that's not happening. And, still having the stress of, how am I going to commute here, and even how I'm going to eat. Like, we have students, we have a garden on campus that actually grows food and gives it away in the pantry. And when the campus closed, that closed. And a lot of our students were relying solely on the food that they got from that pantry to eat. Wow. So it just was a lot of layers, that those social determinants of health that we talking about. Like, the mental is the centerpiece, but what are all of those other influences, outliers that impact that students' behaviors and ultimately their health outcomes? And it was challenging. It's still challenging.
Yeah, I want to stay right here for just a second as we deal with challenges. Obviously, the focal point of everything that you do is student centered. What were some of the issues or thoughts or concerns that were conveyed to you by faculty and staff? Did you see a shift in the work that you do? And maybe you already had some. I think Dr. Lundy alluded to that. But did you see an uptick in faculty and staff, and what were some of the concerns that they were grappling with through this COVID, the early stages of it, and on through the summer, and then also dealing with coming back?
I would say I'm sorry. Go ahead, Michael.
I'm sorry. I was gonna say, I think just initially the biggest one for us was something that we think is simple, but it was just internet access.
Yeah.
When we transferred to virtual, and CUNY wide, over all of the campuses we have across the city, had to do what we call a recalibration. Because when we first closed, we went to virtual. Let's switch online. Everybody has internet. Everybody can. And we found out like 70% of students weren't turning in assignments, weren't showing up to live sessions. And it was like, why? Well, they don't have internet, like something that simple, or they don't even have a tablet or a computer. They were trying to write papers off of their cell phones. So they had to recalibrate. And, fortunate enough, we were able to get funding from the CARES Act and from some other sources, where we went through that recalibration period where we closed for about 2 weeks. All instruction stopped. And we ended up giving out laptops and mobile hotspots. So something that simple. And that was in the middle of that one semester. So now you have this student who was physically on campus one day, the next day they're not. We can't really tell you what's happening, but we'll get back to you. You don't hear anything. You hear messages here, messages there, taking classes online. Now all of a sudden stop for 2 weeks, start back up from where you were at. Remember all of the information you had. Oh, still go to work. Oh, still worry about your Black or brown parent who is disproportionately probably going to be impacted by this virus. Oh, I can go on and on and on, but it was just so many layers that, you don't think about. You think, you don't really take into consideration when you're trying to just deliver, a counseling session, or even just deliver a lecture via Blackboard. So it was very challenging, but like I said, CUNY really stepped up and was able to provide, in my opinion, a lot of the resources these students need to finish successfully that semester.
Yeah, and to your question, Dr. Felton, to me, COVID has been an experience that has somewhat like erased the lines or the delineation between, we talk about what we do for students and what we do for staff. Well, in the same way that students were struggling with internet, we also had staff who may or may not have had as much training or engagement with the online learning platform. So they had to increase their level of familiarity. And for many people that caused anxiety. And so, in terms of what I saw or the kinds of conversations I started having was, kind of helping people push through those difficult earlier on moments of like, okay, not only am I dealing with this pandemic, but I'm also being asked to learn skills or to tap into skills that I'm not used to doing. And as we know, as professionals within mental health, like I believe that change can happen, but change isn't always easy for people. And so for people to grow and step outside of their comfort zone and to be feeling as though they're forced to do that, sometimes that can come with a level of,
Anxiety.
Trepidation, frustration, resistance.
More resistance than anything else.
I will add to that. Definitely, the internet was a stressor for many students in faculty, and it's particularly when it came to the virtual sessions. Students didn't really feel comfortable, or had so many other stresses going on that they felt comfortable having a wellness check or just a check-in or just call me, or mom and dad have to babysit. I have to have a session in the car. I don't really feel comfortable where I am, where, I can be on the face, So a lot of things came up, but also from faculty, how do I reach students? I usually see the student, they're a little bit more engaged. Now they're not engaged virtually. What are some ways that I could check in with them virtually? And so providing our faculty and some staff with some resources, really amplifying gatekeepers at that moment when things were transitioning so quickly.
How's COVID changed you all personally and your work and how you provide the services for your clients?
Yeah, I think the main thing for us has been teletherapy is now the thing. That's how we provide our work. Prior to this, I would say, I don't know if my colleagues would agree, but teletherapy sometimes got a bad rep in terms of maybe it being as reputable. I think most of our clients, and maybe even we feel this way ourselves, like it's just better in person. It's just better in person. I can touch them, I can feel, or maybe, just this idea of connection. And I have to kind of, as is my approach in life, sometimes gently challenge that my students, if they could find some Wi-Fi, they were answering the phone, calling. I did not have the experience of not being able to touch my students. And so for me, teletherapy, the shift I think this was the shift in my own head that, okay, this is a way I can reach students. And it has been like enriching and fulfilling in many ways. Just the ways in which we've been able to have some pretty meaningful sessions. Now, I think as the clinician, knowing that if my client is in crisis, it changes how I can support them from that distance perspective. So making sure that there are, community resources, making sure that if we do need to transition to a therapist or clinician that's closer to you. But we've had some, the shift has been to teletherapy. The shift has been also a mindset change for me that, okay, this can be a viable way of staying connected. And it reinforced for me just how important our role is. I think many of the students I talked to, they were looking forward to the weekly check-ins because so many things were changing around them. The fact that there was some consistency helped with the trauma. And so it's changed me in terms of my perspective about telehealth. And it's also, I think, it stretched me to be someone who, I think I tried to be creative already, but now I'm having to definitely be creative in ways that I had not anticipated. So I feel like I've come out of my comfort zone a lot. Technology is, I guess I'm a millennial. I guess I'm one of the, what you call those in-betweeners. So like, I'm like just a millennial. IGs and TikToks and like all of those things I have had to adjust, adapt, and change and become more familiar or willing to at least try, because when they can't get on a Zoom, they will be on social media. So that's been another change for me that I've had. So the mindset and the technology.
First one I think about is, I'm sorry, you go ahead. I cut you
No,
off the
okay.
last time. You can.
Okay, well, I was going to say, for me, just everything that Dr. Ray was saying in regards to teletherapy, you know, giving the students the option, you know, what would help you? Like, how can I support you during this time? Right. Yeah. You know, it's about them, providing them with the resources that we have. So students really appreciate it, saying, okay, Dr. Brown, this is the way you can support me. So if the traditional virtual session via phone, computer didn't work for them, like she was saying, a wellness check, consistent. Every 2 weeks at one, I'm going to talk to Dr. Brown, I'm going to check in, this is what's going on for me. And doing that teletherapy, as she said, kind of expanded, you know, what we do to set that up, you know, checking in with them, where are you located? You know, if you're in a crisis, you know, getting these resources, getting someone else's phone number and things that we have to do before we even engage in that session. And then for me, I would say just really further examining, I would say enhancing my self-care strategies during this time. We have to take care of ourselves. And so personally, with COVID, you know, having an unexpected loss in my family, having to manage that and trying to navigate grief and everything else has been challenging. So grateful to people like Dr. Ray, where we can collaborate for our students. Our students are very active online, so it was pretty easy for us because we had an active social media platform already for counseling services. Mm-hmm. But we began to collaborate for our students. We began to meet them where they were, and that was on Instagram, and providing chat rooms and finding ways to meet them. If we couldn't catch them via phone, we knew we could find them on social media. Yeah. And that was a great idea, and it seemed to turn out well for us.
Well, sorry for your loss.
Thank you.
I think some of the same trends that we're seeing with colleges across the country. I think the biggest one for us was really coming to terms with how our student affairs departments work together to actually provide that wraparound support. Because before, you know, some work together on, you know, initiatives and events on campus, but I think now that we've all switched to virtual and we all have to be on the same page with our messaging, is really shown how, you know, academic affairs works with student affairs. How does the health center work with the counseling center? How does even financial aid work with judicial affairs and conduct? Like all these departments have to work together, and it's really, I think, made us step up, you know, step our services up in our communication amongst each other, just to make sure, like I said, that all of our services are in sync and all keeping that same message. But those first couple of Zoom meetings with people from different departments, I was like, but we working together now though, because it's showing us our areas where we can fill in and support growth, and even growth. There you go. It's showing that growth, and it's been for the good. It's been for the good. It really has.
You know, I've been counseling, you know, probably 8 of the last 10 years, and I don't ever recall a counselor worried about anything other than why I'm there. It sounds like you all move differently from that perspective. It is more about helping. It is not only about helping kids and individuals through their issues, but there seems to be a genuine concern for welfare as well. Is that part of what happens in higher ed and at our HBCUs, and is that something that is probably only analogous to this space?
I want to jump on
that. I'm gonna just say one statement. I'll just say I've been at I had the opportunity to experience working in management at a HBCU in student health and counseling, and now working in this similar space at a PWI. And yes, I will confirm 100% what you just said. I'm not saying the services are lacking in any
No,
sense.
no, that is not my thought.
Right.
Yeah.
But there's a completely different approach from a holistic standpoint of how HBCU counselors support their students, how student affairs professionals support their students, and not just support them, but understand, I think, the experience. And I think that's, I don't want to say what's lacking, but what I don't see translate like I do. Yeah, it's just different. They don't, it's different having a conversation with someone who has a lived experience about what you're talking about and understands how discrimination and racism plays into everything versus somebody that can't make that connection and tie that into health outcomes and even health seeking behaviors. So yeah, I definitely will say, yes, there's a different approach.
Yeah.
Yeah, I noticed that approach and how different I was, even when I was in my clinical training at Notre Dame. I had the experience of getting in trouble while working with my supervisor, who happened to be the only Black psychologist in the counseling center there. And I was working with my clients and kind of using the same approach that we're talking about, because I think as a Black clinician, a culturally competent and sensitive clinician, that is how I think it's a part of our narrative that we're learning. And so I literally got penalized in my clinical work for or questioned in terms of boundaries. It becomes a boundary question for us as clinicians, because it was, to your point, Dr. Felton, I was caring not just about literally why they were there, but I was looking at all these other contextual factors that made them a human and that made them, a part of my community or just a part of our underserved population. And there was just this level of connection that my clients had with me that, again, was called into question. And then my first working at another PWI for my first job, being the only Black psychologist on a staff of about 20 something people at an institution with about 27,000 students. So literally all the Black students were, sent to me. But part of it was because, we connected differently based on, I think part of our culture as Black folks is that we are community driven. And I think that collectivist nature comes out in the work that we do. And I think in order, I would argue not just that it's specific to HBCU settings. I would say that in order for us to be culturally competent, we have to operate a little bit differently other than what we're trained on. We're trained to be what's called the tabula rasa. So, the stereotype of a psychologist who's got a couch in his office and the clipboard and not saying anything, that will not reach my clients.
Well, they do say, "Oh, tell me more."
Yeah, so that's not going to work. So
Did that tickle you, Dr. Brown?
That my clients would look at me and we'd be in there working with silence because they wouldn't say anything or they would never come back. Yeah. And so I think we move differently. And I think I read something yesterday from someone who's a clinician and she talked about how all of the difficult things that are happening for Black folks right now, racial injustice, but that for her, she wouldn't change one bit. Like there's a sense of honor and pride in being Black and being a Black clinician. And I think the same, like even though in those spaces, those predominantly white spaces, it stood out kind of the way I was doing the clinical work, I wouldn't change one thing because I think that's what helps our students feel loved. And we do know that the therapeutic relationship is what causes the most significant change. So if someone's going to change, if the therapeutic relationship is the strongest indicator of that. And I think our clients connect to us when we are culturally competent and more engaged. And so I wouldn't change that for anything, but it definitely is specific, I think, just maybe not even just to the HBCU space, but specific to clinicians who are Black psychologists and who practice more culturally competent clinical work.
Yeah. I will add to that too. I've had the chance to be at a PWI and an HBCU, and so I would say, culturally competent counseling is so important. We have to be aware of who we are as a culture being, right? And representation matters. And so I think for the students, it's just the family feel, the family, the community at the HBCUs. And like she said, you know, I laughed at President Felton. He said, tell me more about that. That sounds like one of the introductory counseling skills in teaching, but you know, that wouldn't work for students who look like us. And I do believe that they really appreciate having someone that looks like them, that understand discrimination. Like they are really, when you say I'm tired, I know they are tired. We're tired too. Yeah. Right. And so we don't have to say anything, just by maybe a look in passing and be like, you get it, Dr. Brown, you know, just seeing you gives me hope. Right. And so I think in serving in this capacity is really rewarding.
It's sort of like, in a lot of ways, that nod, you know, that you get. I see you. And I think that emanates from the fact that as a people, we have a longing for connectivity. Like we that is who we are, even though we have um, these steel shells that we put up. I think innately, what lies in our souls is this desire to be connected to someone and to space that is friendly and that sees us. I just you know, something was said that made me think, like and it was actually a thread throughout all of your comments about how you care for the students. It's not just about, let me help you manage what might be depression, but you know, what's going on you know, in your life. And I think that really embodies the spirit of that secret sauce that we also are accustomed to having, you know, been on these campuses. Um, what what role does finances play in healthcare disparities, and what resources have you been able to point your students to help them deal with you know, the disparities that they're faced with, and the mental health you know, triggers that are associated by that?
Well, access to care is one of the reasons why we, despite what the popular notion is, we actually have higher rates of mental health concerns. And, you know, partially what contributes to that is that we are not financially having accessible, we aren't able to access the things that we need when we need them. I think if we're thinking about COVID time, and Dr. Griffin talked about this a little bit earlier, but some of finances in terms of like some of our students not having enough food to eat. Some of our students, you know, we have recent storms. I still have students who don't have power right now. And financially, you know, I've talked to students who are staying in hotels right now. They went home wasn't a safe place. And so now they're renting rooms. And so that additional stressor, so finances become the additional stressor that can exacerbate the emotional health concerns. And so if we are able to assist in any ways with finances, I think that reduces stress, which can improve the likelihood of improved functioning. And so our food pantry here was also a resource, I think, for some of our students who maybe were struggling or not able to financially support themselves. So that was a resource we used here. I think also in the process now of solidifying a relationship with certain telehealth and teletherapy apps. So there are certain organizations who are offering grants. So right now, Wiley is considering a partnership with an organization that was sponsored by the Thurgood Marshall Foundation, and that grant will allow a student, regardless of where they are, to access services 24 hours a day. Whereas if they can't reach me, or if they're in crisis on the weekends, they can access emotional support that way and not have to incur any cost. And I think that other apps or services like the one being sponsored by the Thurgood Marshall Foundation are happening as well, because I think a byproduct of our, I'm trying to think how to say this. So with all of the racial injustices that are happening, I do think that there are certain people who deem themselves as allies who are donating money. So I think that a lot of our HBCUs are also getting a lot of financial support to help in ways that we may not have been given before. So I think that provides also opportunities for healthcare that our students may not have had.
I just think that just to add something real quick, I just think the economic impact that COVID has caused to this country, I don't think we could have even imagined the connection between economic outcomes and health outcomes. Like a virus, nobody connects the fact that, you know, we might have record unemployment numbers or record people, you know, getting evicted or losing their job. I don't think people initially could make that connection. And I could probably talk hours about public health in the United States, like, whew. But I don't think people were able to make that connection between, you know, how a virus or the threat of a virus can actually impact your ability to earn or your ability to earn for your family. And as we know, a lot of our HBCU students and especially African-American students, they come from, not all of them, but a lot of them come from low income backgrounds. They're working to provide to support their families, especially here in New York.
Expound on that for a minute, Micah. Expound on that. Like how does a virus create this domino that makes what looks like a virus to be catastrophic, what is a virus to be catastrophic in certain populations?
Right. I think it's the way we view public health in this country. I think it can all the way go back to that. Even when you think about our healthcare system, a lot of people will call it a sick care system because there's more money invested in treating the disease versus actually invested in the improving the behaviors to prevent you from getting cancer to begin with. And the only way we really can combat COVID-19 right now, like factually, is social distancing and wearing a mask. Like those are the only, there isn't a vaccine. There isn't a real treatment out to prevent this. We're still learning more about this virus every day. And I think just the lack of investment in how we treat certain diseases or how we prevent ourselves from getting certain diseases is playing out right in front of our face.
You know, but here's where I struggle with the apathy that we have, or the apathy that is associated with us as it relates to trust in the government, which is the healthcare system. When you talk about the Mississippi appendectomy and the Tuskegee experiment, just those two things right there, people are still alive who went through that garbage, right? A woman going into the hospital and coming out without the ability to reproduce, but she went in with, you know, an Achilles injury, and all because they being the government and white America, wanted to train other folks without the consent of black folks, to subject black folk to, you know, gonorrhea or syphilis or whatever it was, and intentionally not treat them. I mean, you can go on and on and on as to why folk can be validated with their mistrust. How do you balance that mistrust with we're a little more advanced? There are things to help you be a lot more educated, because I'm concerned about this vaccine and the trust that largely in our community that people will have. And that's up here, right? That's up here, and there's remnants of this here, but I think up here we've got to figure out how, if herd immunity is one of our best chances, but if vaccine is one of our best chances also of moving forward, we've got to be able to tackle what's going up here mentally, that is predicated legitimately on the actions of the federal government. How do we deal with that?
Oof.
That's another
You said,
podcast.
you said that's a whole, man, we could do a whole series on that.
Yeah.
You said something right there.
Yeah.
You said
that might
something
be
right
part
there.
two. That may
But no, that's playing out. That's playing out. Like you can look at African Americans being disproportionately impacted by COVID. We're not genetically predisposed to get a virus at higher rates than somebody else,
Right.
but the years of systemic racism that have developed those risk factors and those health behaviors in our communities has made us more prone to getting this virus and dying from it. What I noticed happened in New York City, and I can just speak from living here, from experiencing this and being through this, is there was an immediate shift to how the message was delivered. And not just from Governor Cuomo, who you saw on TV every day, but there were actually people on his team that look like you, that look like me, that were bringing up these conversations about the impact of racial disparity and how it's impacting these communities. So you started seeing testing sites pop up in these neighborhoods, not just one or two. You go past 125th Street in Harlem, you're going to see a whole lot of testing centers, and there are people actually getting tested because there are clinicians that are at the centers, the contact tracers that are now having to go and knock on your door and ask you, where were you at the past 2 weeks? Looks like you, and they're from your community. So I think
that's a level of trust with that.
It's a level of trust. It's being intentional with your level of trust. It's not just propping somebody up because they look like you, delivering a message, but not really putting action behind it. It's actually invested in those systems and in those people to really change that narrative. And it's not going to fix everything. It's not going to significantly lower rates. It's a start. It's an amazing start. And I think it slowed down the rates that we were seeing that were shooting through the roof in our community. Just slowed it down drastically. Just those efforts.
I don't know how we tackle that in the short term, because actually I read that 2 fellow HBCUs right now are encouraging people to get tested, Xavier and Dillard. Yeah. And when I read that, I had my own reaction, like, okay. But what, to Micah's point, both presidents of those institutions have talked about that they themselves are part of the clinical trials. And I think that does set the precedent, or it says, okay, we are willing to be in this with you and to demonstrate that there is some level of trust. And I think that it underscores the message that you all were saying, that we've got to kind of approach how we're talking about this with people who look like us.
And I would just add, like President Felton saying, kind of the fear and normalizing their feelings and experiences, this history of mistrust, right? And so we have to really validate for our students and people who look like us. Yeah, that's true. That has happened. And as Micah and Ray are saying that, we're in this too. We're in this fight. It's about prevention. And when the prevention education comes from people who look like you, then there's let me give this another shot. There's somebody who looks like me that's really talking about, the how this is impacting my community. And perhaps I can join in this cause and be a part of that effort. And so I do think the representation matters, and how we educate and promote testing for our students in our community.
Yeah, I think and we are a complicated, granular type people, right? I can't go knock on the door with this on. Micah is going to have much more success with a button-down t-shirt or a button-down shirt walking through Brooklyn talking about, helping getting tested than I would, simply because of what this oftentimes represent even in our community, and so when you have representation at the epicenter of communication, then things are much more likely to go our way and to the way of those who need services to be rendered. When there's representation and that intentionality is necessary. I just know that I saw that letter from both President Kimbrough and who's that, Xavier? Barrett, and said to myself, ooh, boy, I want to see how this goes, right? Because I'm thinking, the first thing I thought about was trial. Now, we're not about to be, a trial, and of all places in New Orleans.
Right.
But then when you read it and you see that, hey, we're a part of this,
right.
Then it made me feel like, oh, okay, Well, that might.
But still a little uneasy though.
Absolutely.
If I'm being
Absolutely.
honest, I still, as a Xavier alum, I was thinking, whew, okay, well, I
Well,
don't know if I were there as a student.
yeah.
I don't know.
Well,
Right.
I think the hyper partisanship that we have in this country too really makes you see things playing out, and you see what normally was without question the gold standard CDC and the FDA. If they said something, you went that way. If they said go right, even though there's a grizzly bear over there, you're going right. And now there's this question now of whether or not efficacy is really the guiding factor. And while we don't watch CNN and MSNBC and all those things like the most people, we do know what is going on. And so that, I had a confluence of things rush through like, wow, this is some good leadership, or this could go either way. So it's happy, but it also made me think about the root of why there is skepticism almost instantly when we talk about testing and trust. Um, I,
Real quick, I can just say one thing about that
yeah,
vaccine.
sure.
I've never in the history of vaccines seen a vaccine get approved without going through a phase 3 clinical trial.
Mhm.
And for people that don't know about vaccines, they have to test them and 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 test them because there's so many things that can happen. Like those late night commercials on drugs when they say your arm gonna fall off and your pinky toe gonna. It's because it happened to somebody. Somebody arm
Yeah,
fell off and
in
somebody
the
pinky toe
trial.
fell in the trial.
Yeah.
And the vaccines that are talking about coming out around election day
Hmm.
would not have went through all of these clinical trials. And now you're going to say we're going to give them to people who are most highly impacted by this virus or have died disproportionately from this virus, and that's us.
Yeah.
So they're going to, and that's the justification that's going to come behind why we have to flood the Black community with these vaccines, because you all are dying from this. So you most surely want this vaccine that hasn't gone through all of the safeguards or testing that a vaccine normally goes through. So those are, just to add to what you were saying, I agree 100%. Those are going to, that's going to be the reprehension that people, or the apprehension that people are going to have about, getting a vaccine.
I've
Rightfully so.
been quoted for saying that leadership is some tricky shit. I think this vaccine, the whole thing is just tricky. As an American, I want nothing more than us to return to some sense of normalcy, and I want to do my part. But I need a vaccine that has been through some trials for me to feel completely comfortable and it's just scary. So we know that there's just a lot that's going on. Do you guys see things ever going back to normal in higher ed on our campuses as it relates to mental health and physical health care?
No.
I don't.
Plain and simple.
No.
No,
No.
no.
Why?
And honestly,
What, what,
I wouldn't even want it to go back to, I mean, college health in general is a relatively new field. I mean, it's been around, but in terms of just other fields of healthcare, is relatively new. I mean, there's not even a framework of how you deliver health services across college campuses, all doing something different. But what I think this pandemic has forced us to do as student health professionals is examine how we are delivering these services. And Dr. Lundy brought it up. Just being able to hear and see what other colleges are doing to say, hey, that we can try that as well. And I think that's what's missing in just the conversation about COVID in general. There hasn't been one general response on what you're going to do. We have 50 states, and all 50 states are doing 50 different things.
yeah.
We have, I don't know how many colleges in America, and every college has a beautiful, amazing, well done reopening plan with
Mhm.
beautiful campus pictures, amazing graphics, but they all say something different for the
Yeah.
most part.
It's a
So
little
no,
over
I don't.
4,000 of them. A
Yeah,
little over 4,000 of them.
and
Yeah.
all of them got different plans,
Different.
but they all basically saying the same thing, just different ways. So just to sum that up, I don't, I don't want us to go back to how it was. I would like to see college health move into a direction of there being standards of care. If you go to your doctor off of a college campus, that center has to be licensed, credential, accredited, college campus health centers, there's no standard that says you have to be accredited to deliver this care. Not saying that your center doesn't have to be accredited to do a great job, but how we deliver services to address one thing, COVID, there needs to be a model moving forward with how colleges engage students from a standpoint of protocols, processes, procedures to how we address this. And that's what I would like to see, I think, moving forward from just a delivery standpoint.
I think you guys are the reasons and how that happens, right? We have to be cognizant that there's a standard that our students deserve. And when I say we as administrators have to be cognizant of that. And then we have to find people who can deliver that standard and then get out of their way and let them do what they need to do and support them, right?
Right.
But I think that's the solution, Micah. I think that is the easy solution is for us to invest into culturally competent professionals and let them do their jobs.
I think that's a great idea too, President Felter. I think we in mental health, we will always have some sort of now teletherapy. And so in my ongoing discussion with various counselors and directors and administrators is the conversation of the budget and what would that look like. There have been some centers where if we're going to do teletherapy, so do I need a person? Do I need this physical body on campus? And so I do think we would get to a place, maybe a happy medium where you do both, because I do believe the students deserve that face-to-face connection. And it's about the whole of the student, right? And so that impacts their experience, the student experience, and we think of their well-being. And so I think we will see this form of virtual therapy continue throughout as we're transitioning to this new normal, whatever that will look like.
Cool.
Yeah, I concur. Teletherapy is here to stay, and I think I know for campuses who are in person now, even thinking about in the spring, even when students return to campus doing teletherapy, because how people feel about moving about campus as there's still no vaccine. So I think the best way to answer this question is there is no going back. And now we have to decide what would we like it to look like moving forward. And I think, I guess if we use a term that's probably been going around now, like hybrid, it's going to be a hybrid of a lot of the things that we used to do and a lot of the new things that we want to continue to do, because we probably needed to meet the students a little bit more where they were. Mm-hmm. You know, we probably could have used, I can say that I feel sometimes is a little guilty, even though we're culturally competent clinicians. Clinicians can be a little stiff, right? When my students started reaching out to me on social media, I was like, oh, wait a minute, this is my personal space. This is a boundary I don't want to cross. And then it was like, well, but that's where they are. And how do I, so I think we needed a little bit of pushing, and I don't want to go back. As you said, Mike, I don't want to go back there either, because I think it's made us better.
I hope your response is reflective of all healthcare professionals especially in the Black space. But I know Micah, having been educated at an HBCU and worked at one and been to graduate school at one as well, too, right? Mm-hmm. Did you go to, was it Alabama A&M that you got your master's from?
No, I worked at Alabama A&M. Okay. I just went to HBCU undergrad, yeah.
Yeah, I know. At Livingstone.
Yeah, Livingstone. Let me plug that. Plug that real quick.
Yeah, he wants to plug that.
LC?
Yeah. Who you with?
LC.
Okay.
You can't throw out who you with without me saying that.
That's right. So I was at Livingstone during Micah's last year or two. I got there in 2007, and he graduated in 2008 or 2009.
2008.
Wait. Okay. But I say that to say I hope that all those in this space understand that you're going to have to give a little of your space in the space of service particularly in the mental health space. I know, for me, I speak with some of my more senior colleagues, and the notion of engaging, like students have my cell phone number, my personal cell phone number. Like, yeah, I remember one question like, well, why would you do that? Well, I get to, really determine whether I want to answer the phone or not, right? So I don't have a problem, but I know that a student who may be shy and afraid to approach a person of authority, if they have the capacity to reach a person of authority and they can do it where it doesn't take anything away from them, then I know that's 2 or 3 texts a month that I get that I'm able to alleviate pressure from an already tense situation, which is being in college, right? Being in college is a tense situation for some folks. So happy to hear that you clinicians understand that there's a little space of your personal, a little of your personal space that you have to give up. Not all of it. I'm not suggesting that you do that, but I think understanding that
You don't
is
have to worry.
okay. I'm just
Yeah, I was saying for me, it's definitely just having a separate social media, like having a counseling services Instagram page.
yeah.
And definitely couldn't give out my phone number because we just have to maintain boundaries. But
Yeah, y'all are different. Y'all are
yeah, we are. Thank you for understanding.
yeah, no, I appreciate it. Yeah, y'all are different.
Yeah. One thing we didn't talk about was the connection between mental health and spiritual health today. And I think that actually was the first time I realized just how different we are, because our Dean of Chapel here, Dr. Robinson, she is, she has, like Dr. Felton, access. And she was like, and one time we were together and like she gave my number to a student. I was like, whoa, wait a minute. I wasn't ready. Whoa.
Yeah.
That's not what we do in my field. And we had this discussion about like how things are different in terms of boundaries. But then there's been this ongoing discussion too of like COVID has changed that in a lot of ways. And so we're stretching. I'm stretching. I do think boundaries are important though. And sometimes our students need to know what it means to say no or to set limits.
Yeah.
And that's a healthy life skill as well. So
That most certainly is. We have to teach them sometimes. They just aren't aware, and they respect it and they understand.
They do.
They do understand.
What's your greatest joy of this work?
You know, I take this, when we think about the whole of a student, that I am helping a student. That could be the next president, right? That can be the next sergeant. And so I'm thinking about how I am really facilitating their change and providing them with some tools, like they're empowering them to do the work, to continue to move forward as leaders, and especially for students of color that look like me. So it's very rewarding when they come back and say, hey, Dr. Brown, I'm getting some rest, something simple like I'm resting, I'm turning my cell phone off, I'm saying no. They're happier, they're well. And so it's rewarding to me to see students emotionally well and able to function and move forward in life.
Yeah.
No, I would just agree. I think, I would just agree. Like, I think that's honestly the single probably greatest joy. And although I'm not a clinician, but just managing, counselors and even our medical staff when I was at Alabama A&M, just when we had events, just to see the students that would come just to be a part and just be in that environment, not even getting a one-on-one counseling session, but just because they knew that we were going to be doing something like art therapy. We were going to do dance therapy, or just being able to be connected and just seeing how that was able to grow. But it was able to grow because our clinicians built those relationships one-on-one and opened up that door and showed that student that there are ways that you can better yourself that doesn't always require that one-on-one interaction only. Like, you can do that, but there's also alternative ways of increasing that joy, increasing that, personal satisfaction, increasing that, self-esteem, and all of these are connected. So I think just seeing how students were involved and engaged when we had different events on campus that our center hosted, and they would just come out. Like, it started where, we had a very few, students attending, till we would have events where students would just show up because they knew it was going to be a great, positive environment.
Mm-hmm.
I think similarly, when I can see a student who was not coming out of their room, was extremely depressed, or even I think about some students who, poor when I can see the transition and the change, and they come back and they email me, they will find you. Like, again, we talk about boundaries. I get emails at Wiley from when I worked at UNC Chapel Hill about like, you changed my life. I'm here today, like a remember sometimes like all the ways in which I think because we are of service and we're constantly doing it, when I can see, okay, this person, wow, we had such a tremendous impact on their life. But then if I can remember, like, wow, when I first met you, you weren't able to do, you know, X, Y, or Z, and the work that we did together, your life is, you know, irrevocably changed. That to me brings joy, because it feels like I'm making a difference and I'm making an impact in the world. And that's one of the things that, you know, in terms of my life's mission, is to really make an impact. And when they can come back and tell you, it brings joy to my heart.
As we cut across the field and you know, make our ways back to work, what do you say to the student right now who is challenged by the socio-political strife and division in the nation right now? I'm having a really hard time dealing with a space that I know my life doesn't matter in. How do I deal with this anger and this frustration I have because of this space that I'm in right now?
I'm gonna let my colleagues answer, but I just want to say I think that that is a very difficult question to answer, as we are gonna like cut across the field, as you say, like that. We could have spent an entire hour talking about. There's so much there, but I'll let my colleagues talk.
Yeah.
I think just honestly having conversations about it. And I think that goes back to what we talked about with your clinician being culturally competent to understand that that can affect you. Because before, I mean, racial injustice is at the forefront of what's happening right now, but we've been seeing Black people get murdered on camera, on TV for years.
Off camera.
Off camera. I mean, these are just the ones we're seeing. Mm-hmm. So it's not new to us. And when you have clinicians that understand that and opening up that dialogue and having those conversations, I think students at this age, that 18, 19, 20-year-old age, where they're most impressionable, they're able in their minds to make that connection that, you know, I can talk about it in this space and I can talk through it. I can talk about how I might not have actually known Ahmaud Arbery. Seeing him lose his life over and over again on TV actually impacts me personally. And even me as somebody who I like to think I'm pretty emotionally intelligent, but this has been hard. Like this has been, I mean, it's been hard. And my wife just gave birth to our first son like 2 months ago. So in the middle of this pandemic, you know, seeing Black men, you know, lose their lives over and over again, and it being portrayed across different channels is over. I mean, it's just that constant barrage of just this information where I can't even watch it. Like when I hear that it's about to come on, I can't even. And I used to be somebody who, I mean, I like action movies. I like, you know, them type of violent movies, but this is real life. And to know that I live in a city where I could just forget to put my signal on and get pulled over, and it goes from 0 to 100, and now my name is hashtag something. And to look at my son and to know that I'm going to have this conversation with him in some capacity one day that my dad had with me 30 years ago.
Rob his innocence.
I'm going to have to. And I don't even know.
Early.
I don't know how to do that. And I know I got time, but just knowing that this conversation is continuously happening. And I know my granddad had that conversation with my dad, and his dad had that and it's just that constant thing. But I think having those conversations and me being aware and being able to make these connections in my mind personally, I think is what gets me through it, and being able to pour out into other people. I just have something to give, because it can drain you. I can't speak for clinicians, but I know it can drain you. And then still having to pour out into somebody is difficult.
I would say, Micah, congratulations on the birth of your son.
Thank you. Appreciate
congratulations to you.
Yes, sir.
And just listen to what you're saying. You know, this speaks to generational trauma, right? And your father and your grandfather, and thinking about our community. And it's very we are exhausted in dealing with this repeated racial trauma, injustice, and things that are going on. It's challenging. I think it's okay to say I'm hard. I mean, this is hard for me. This is tough. You have every right to feel what you're feeling, that you don't matter. And then as clinicians, we take it a step further, and begin to check in and see how they're doing emotionally and connecting them with support and trying to instill some hope and offer them with resources. Yeah. Especially because these things are happening in our community and we're not talking about it.
Yeah, I'm always, you know, I'm struck by our athletes who have done an amazing job in bringing visibility to the situation in ways that we haven't in a while. And one in particular, Robert Ory, explained to his colleagues that a lot of this is not about obviously racism has something to do with it, but what struck me, I brought this to my attention, was Dr. Brown's comment about the generational trauma. And he was explaining that oftentimes these things escalate because young men are proud. All we have is our pride. And oftentimes, some people come and there's an encroachment on that pride, and we need tools to understand how we need to live to fight another day. How we can channel that pride in a way that allows us to live to fight another day. And he talked about his parents and their parents, and how they, living in Alabama, had to deal with, every generation had to deal with some form of Jim Crow, and how devastating it was, and how it impacted the family moving forward, each generation. And so when you said, this generational trauma, it made me think about his comments, and even in my own life, having witnessed stuff, and having family members be a part of Axe Handle Sunday in Duval County in Jacksonville, Florida, and and my grandfather being a World War II veteran and coming home and being spat on and talked to like he was less than the hero that he was for being in the Navy. So final thoughts. What do you hope for our students and for the nation coming into our new reality, COVID and something else? The one hope that we have is that the pandemic of 1917, 1918 happened, and the world advanced. And so we know that there is something on the other side, and we don't know when that other side is or what it looks like. But what is your hope for managing through this pandemic?
I'd say my hope is connected to something, Dr. Brown, you talked about earlier. I heard you talk about your self-care. And Audre Lorde talked about self-care being a political act, and it being something that you could consider radical. My hope is that on the other side of this, people know that it's okay to take care of yourselves, and that actually, in fact, doing so is not a luxury, but it's essential to your overall sense of being. And also that for Black folks, that it's just essential. It's also a part of our humanity that we get to experience not just rest but joy. Yes. My hope on the other side is that we begin to, despite all the things that have been perceivably taken from us and actually taken from us, that we can live lives that, in spite of those injustices, and I think we do this, but I think other times capitalism and the idea that you have to grind until you pass out, until you don't have any more to give. On the other side of this, I hope that we can let go of some of that, and that the pause that COVID gave us, this idea of kind of slowing down, that we hold on to that we don't let go of knowing that it's okay to rest and to be still.
I would say, to add to what Dr. Ray is saying, that we are charged with the well-being of our students, and sort of like our, like she said, our clients, but generationally, we're taught, this, I like to say, unhealthy manhood. Men taught to suck it up. Women have to be strong. And so we have to empower this generation of students, that you have the power to change that narrative in your family. You don't have to carry that. You don't have to be strong all the time. You can express your emotions as a young Black male. It's healthy, right? And so we have to let them know it's okay to slow down. It's okay to look after your well-being. It's okay to just be. And understanding that when we teach them and understand historically why our aunts and our uncles or our grandmothers and things, why they were doing this, survival. But they can learn to be happy and learn to take care of themselves and not feel guilty, right? And not feel guilty for saying, no, I can't come to the movies, or I can't join you all for a virtual. I'm just going to take some time and get some rest and be okay with that. Because we need those. Yeah.
I think for a nation, I hope that this is that moment of reconciliation that is so desperately needed for us to even move past the fact that it's difficult to say Black Lives Matter still. Like, I hope that this is that moment of reconciliation where us as a nation is able to recognize and we're able to shift the consciousness of people, mostly white people, to understand the connection of slavery to where we're at now, because there was never reconciliation after that. So I hope that this moment, from the sentimental expressions to the painting Black Lives Matter on the streets to some of the more actionable items, like you mentioned, that are happening across the sports leagues. But I just hope that there's a moment of, the importance of Black life and how it's prevalent in just about everything. I hope that actually leads to, I think, us as a nation reconciling for some of the atrocities and, the huge amount of disparities that, us from the Black diaspora have experienced. So I do hope that as a nation that we actually take advantage of this moment and turn it into something that's withstanding and allows us to move forward as a people. Like you said, come out of this like how we advance after the pandemic. And just from a college perspective, just from college health, like I said, I hope that race and the connection to health equity is tied together more on our campuses. Even down to colleges changing the names of racist Confederate generals on their buildings. I mean, those are just steps, but I believe those are steps that need to happen. So I just hope that from a college health perspective and just colleges in general, from presidents, across the board, that we recognize the value and the importance of having professionals like ourselves that understand the connection between these two, and then putting them on your senior staff. That's just my only plea.
Yes.
Presidents across the nation, you need to have a senior level healthcare professional on your senior staff. Like, that needs to happen. There needs to be a chief wellness officer, a vice president of student health. That needs to be the case, because it doesn't make sense how I'm not going to go down that road, but you need to have senior level.
Phone for a second, my brother.
Senior, we need to have a senior.
Strategies now.
It's showing us more than anything. Like, public health, like, you happen to shift. Like, public health has to be intertwined with how we deliver student services.
Mm-hmm.
Like, it has to be. Student life cannot exist without wellness being at the center of that.
Absolutely.
If you don't have somebody on your senior staff informing those decisions, like you said, Dr. Felton, helping shape the decisions you make that impact everything you do from a college standpoint, then you're going to run into the situation a lot of colleges run into now, where you open for a couple of days and then you close.
Mm-hmm.
And people were telling you should have stayed closed, but if you would have had somebody that had that insight, that can speak from a holistic health equity, health promotion standpoint, that can inform those decisions and actually have those decisions turn into policy that actually impact what students are doing, now we changing the whole dynamic of what it means to be student-centered and focus on student life and student affairs.
So that we're also not so reactionary, right?
Mm-hmm.
Like, it feels like now a lot of what we're doing is trying to patch what's happened, but having those, positions and having people in senior leadership who have that insight, they can help you plan forward for instances like COVID.
Yeah, I'd hate to, to do a shameless plug, but whoever that president is at Wiley College is he's pretty much getting it right. He contacted his AV, his associate vice president, who sits on the president's cabinet, not the executive cabinet, but the president's cabinet, and told her simultaneously to help him with some information. I remember being in D.C. before I even got back. I knew that we were going to shut our college down, and we were one of the first. I think we were the first HBCU to make the announcement that folks were going home. But I knew that our professionals had to be at the table. They drove the policy. I leaned heavily on them. I didn't want to hear what anyone, and I'm kind of like that anyway. You know, whatever the subject matter expert is on the campus, and you know the situation falls into their ball and court. I lean on them first and make sure that, you know, oftentimes I haven't had this experience of their information not being credible, but for me, I don't want to hear what anybody else has to say. I want to hear what the professional, the subject matter expert has to say first. And so with us, she drove our policy. She and our nurse drove the policy, and I think you're right, Micah. It is something that you know people need to make sure that there is a space at the table where you're definitely hearing the voice of that healthcare professional. And I think what COVID has done and will continue to do is have us reimagine everything. And certainly healthcare, health and wellness, and mental health counseling is chief among those things, because we know now that what we're dealing with now is not, you know, it stems from that. And so I think you're absolutely right. And kudos for you all for saying that. And I think you need to be at the top of the mountain, you know, really driving that message home. Don't be behind the power curve, because I'm telling you that there will be a movement for this nationally to happen. And don't be over in the corner when it happens saying, you know, I thought about that, and we were loud, and our organization was really loud about that, but we didn't do anything about it. You've got to find a space that allows you to have voice, and to really advocate for those things. And that's not really asking for much. And one thing that I know with starting this foundation is that many people have had this idea, but none of them have acted on it. And that doesn't make us any more genius than they are. It just says that the tenacity and that inner conscious that I heard, I didn't allow for it to be a roar. I listened to it then. And I think most folks don't listen to that inner voice until it is a roar. And oftentimes it's too late then. So that's my piece of advice to you healthcare professionals. At least one of us has heard it. And I will continue to advocate for that as well. Um, I want to thank each of you on behalf of the foundation. We started with healing and we ended with hope, and in between, we talked about a great deal of things. And I couldn't be happier for the expertise that you brought. And what sticks out most behind your brilliance is your compassion. And I think when we're able to provide a quality education and kids don't have interactions, or when they have interactions that are replete with grace and care all around our campus, we have the propensity to graduate a whole person who can go out and be a part of the global society in a good way, in a healthy way, in a whole way. And that's a double entendre right there. I have to flex my muscles every now and then, especially with Ray Lundy, because she's an editor. She loves to edit things, and she and a couple other people on our campus are really excited about Word. So I have to let her know that I'm there every now and then. I want to thank you all. I'm so grateful, and wish nothing but the best of you, Dr. Micah Griffin of Kingsborough Community College in Brooklyn, New York, Dr. Shanita Brown of Virginia Union University, and Dr. Ray Lundy of Wiley College, Associate Vice President for our Health and Wellness Center. We are forever grateful and indebted to you. If we can be of assistance to any of you, do not appreciate you, wish you peace and kindness and blessings to you all.
Thank you.
Thank you so much for having me. Thank you. You all stay safe. Yeah.
All right,
You too.
Look forward to collaborating soon.
yeah, whenever we can go outside and play.
Yes.
There you go. Y'all take care.
Michael.
Bye, everybody.
All right, bye-bye.
Take care of yourself.
You too.